I like that preventing injuries is a good outcome.
Alright, I think Daniel, it's all you.
When referring to genders, again, we want to bring in not only genders but sexuality. Do you find any group that you would be, for yourself, you would allow them to get away with more? Like males, females, transgenders, homosexuals, things like that. Would you allow one group to get away with more of a aggressive behavior?
Well, I guess the answer is dependent upon how we interpret aggressive behavior, and it almost speaks to a kind of cultural competence. I mean, some of us might interpret behavior as being aggressive that's not aggressive at all, or that's not aggressive, no more aggressive than anyone else. I mean, certain people are more vocal, more demonstrative, louder. Some people, just because of their makeup, tend to bluster and threaten and are louder. So, I mean, ideally, people should be treated fairly and similarly.
I understand ideally, especially in the hospital field, you want to work in ideal circumstances, but we are given the most unideal circumstances at times. So again, I would like to ask, you coming from a large array of background, especially switching from the criminal justice field into the health field, I mean into the more hospital, community hospital field,
Mm-hmm.
Do you notice people allowing a certain group to get away with more? So if a male were to get vocal, would they be more quick to respond to them versus a female getting more vocal? Maybe the female, it's just, I mean, you know, is there more leniency to one group more than the other? Do you think?
I think I've seen that in criminal justice settings, more than in a hospital or a clinical setting.
So between females and males,
Mm-hmm.
would you say the same for sexualities?
No, I'm.
So it's just a mainly female to male ratio.
Yeah. And I think in the criminal justice system, 80 to 90% of the people there are male. So.
Has there been a time you have ever regretted restraining or not restraining a patient?
No, not personally.
And I noticed that you were saying earlier, which I was thinking, do you ever feel, or have you ever noticed anyone feeling peer pressured into restraining a patient in order to keep control?
Well, that's a good question. I don't know quite how to answer that.
Well, I just noticed that you had mentioned
I think that some people who are maybe less experienced or maybe who are frightened themselves may be quicker to act.
Do you think peer pressure plays a role?
I suppose it could. Yeah, I suppose it could.
Have you ever experienced it yourself?
I haven't, no.
Do you think restraints would ever be used in substitution of staff? Like if you're shorthanded, you're more likely to restrain someone rather than actually dealing with them?
I don't know the answer to that. I mean, I haven't been here long enough to
well,
really,
in any field,
to be able to say, you know,
I know in the criminal justice field, you guys are